Cannabis, also known as marijuana, has over 100 active components, some say over 700. Today I'll be talking about the two most common, THC and CBD. THC molecule interacts with the neurological receptor in the brain called the CB1 receptor. As such, because it's activating in the brain, it's great for neurological illnesses. It's great for anxiety and stress, PTSD, Tourette's, seizures, anything having to do with neurological issues. That's what THC is best for. It's helpful in migraines, in sleep disorders like insomnia. It's good for appetite, to increase the appetite, because these are all brain functions, all upper neuronal functions. It's particularly helpful in things like upper neuron pain. We'll talk about CBD, which helps in peripheral pain, but upper nerve pain symptoms are best treated with THC. It's good for reward and addiction issues as well. THC is found prominently in the gut as well, so it's good for nausea and vomiting, and disorders like gastroparesis. So we're talking about Crohn's disease, irritable bowel syndrome, and then also muscle issues, things like muscle spasms and fibromyalgia, well treated with THC. So that's where the THC is most useful, brain and gut issues. THC, because of its interaction in the brain, can cause problems with learning and memory. Short-term memory loss can be an issue. And certain people are susceptible to severe psychological issues. People who are predisposed to schizophrenia, for example, sometimes the THC can send them over to a true psychological break. Novice users of THC sometimes find when they first take it, if they take too much, they'll notice their heart racing. If they stand up suddenly and get some orthostatic hypotension. Those effects usually go away quickly, not only after the first use, but with more time, they're less likely to be bothersome. Now, in contrast to THC, the CBD interacts mostly in the periphery with what are called CB2 receptors. THC does CB1 in the brain, and CBD does CB2 receptors peripherally. So it's very good for peripheral issues, particularly pain. It will numb pain fibers, so people who have arthritis or burns or a peripheral type pain, a sprain, that's what CBD is particularly good for. CBD also has side effects: dry mouth, fatigue, diarrhea, drowsiness, and reduced appetite are known side effects of CBD. But what works best is to take the medications together. Take the plant medicine, don't take the medically derived single product, because you don't get the effect called entourage, where not only the CBD and THC work together, but you get the other molecules, the other cannabinoids and terpenes and flavonoids that make a big difference to work in concert, entourage, to have best effects. When deciding dosage, start low and go slow. So, for example, if you have migraines, you may want to start with a low dose of THC, 1 milligram, maybe 2.5 milligrams, and work your way up. And do it with a CBD ratio. Usually, with something that's more THC specific, you'd start with a 1-to-1 ratio THC to CBD. But if you find that there's too much excitability, you might switch over to a 1-to-2 or 1-to-10 ratio. Now, on the other hand, if what you're looking for is something that's more CBD oriented, like arthritis or chronic pain, then you want to do a high CBD to THC ratio. Start with a 10-to-1 or even a 20-to-1 ratio of CBD to THC, and start with low milligrams. Start with maybe a 5 milligram CBD and go up to 10. A lot of this is self-regulating. Everybody is different. Everybody needs different amounts. So you start low, raising your amount slowly. So a typical dose of THC CBD would be around 5 milligrams 3 times a day. That would be a typical dose, but you need to find what works for you. As an example, let's take anxiety. If a person has chronic anxiety, they're going to want to have the CBD in the higher ratio because that's going to calm them down. But if they're having acute episodes like panic attacks or acute anxiety, then they want the THC, which will have a very sudden effect and help them deal with the acute anxiety, give them the confidence and help with their anxiety. So even though both medicines are useful for the anxiety, depending on what type you have will make a difference on the ratios and the medicines you want. Now, a few warnings about cannabis. The studies on pregnancy are mixed. There are definitely some studies that suggest that heavy users of cannabis have a lower birth weight babies. Not very well proven, but meanwhile, it's probably best to avoid taking cannabis during pregnancy. Breastfeeding, unless a person's a very heavy smoker, it's true the cannabis goes through the breast milk. Both the THC, CBD, and the other flavonoids do go through breast milk. Again, small doses probably aren't going to be a big effect, but heavy users, if you're taking high doses, avoiding breastfeeding would be appropriate. Children and adolescents, particularly ages of 14 to 19, really should not be using any THC, probably no cannabis at all, because that's when the brain develops. The studies are not that reliable again, but there's a suggestion that it's best to avoid cannabis during those ages, 14 to 19. Older people, there's a lot of interaction with medications, particularly the CBD, particularly seizure medicines, antifungal medicines. Occasionally, heart and blood pressure, somebody who has unstable angina, and they take THC and their heart rate goes up and their blood pressure drops, they may have some heart issues, but in general, it's pretty safe. Cannabis use will never cause death by overdose because there are no cannabinoid receptors in the brainstem which regulates your breathing. Now, as I mentioned, there are many other aspects of the cannabinoids besides THC and CBD. Particularly, there are the terpenes and the flavonoids, and each of these has their own smell. Actually, THC and CBD have no smell, so when you're smelling the cannabis, it's from one of the flavonoids or the terpenes, and they each interact, as I said before, in entourage. So you may want to experiment with different brands, different breeds of the cannabis till you find the one that works best for you and your condition.